etmek olar mı? Boş vaxtımızda oynayardıq.
Thank you so much for your question, and good afternoon, everyone. I'm honored to greet you on behalf of the PAS Center. Since 2016, we've been partnering with the stakeholders in TB in Azerbaijan to work to advance the people-centered model of care. And indeed, apps and plays are part of our offering in Azerbaijan. So to just give you a bit of an understanding of what we have been doing, and I'm happy to greet our partners from Sagam Liga Khidmat Public Union, and thanks for your invitation today, is that it's the grant that we work together in Azerbaijan, in another 11 countries in Eastern Europe and Central Asia, to bring innovations, to put people in the center of care, and to improve the results of the treatment for sensitive and drug-resistant TB. And actually, in the project that we implement together with our partner, civil society partner, Sagam Liga Khidmat under TB Rep, is actually aimed to strengthen community data generation and community-led monitoring to enhance people-centered care and improve access and quality of TB care. And we do this by adjusting and implementing a community monitoring app that you can have on your phone, and train people to use it. And I'm sure you children do not need too much training for that, and you can actually help your parents in doing that. But for adults, it's a bit more difficult. So that's why the civil society partner is the one to help patients with TB and their families and the providers to use the app to improve their access to care, but also to react and improve their quality of care. So in response to that first stage, we are happy to see that there are already some real life tangible outcomes. First of all, it's for the fact that people who access this app actually tell about their difficulties in accessing social support and allowance. It helps the organization to help them access that support that is available. And the other good outcome is that this also generates systemic level changes, so that together with the grown-ups and the stakeholders, there's action to improve access to medication for side effects, such as this is an ongoing now effort of the civil society organization together with Tabib to actually work on making these medicines available for everyone. But I want to come back to the theme of today and your event and this year's TB topic. You know, it's called the clock is ticking. You know why? Why is it ticking? The fact is that in 2018, the world came together in New York and decided that TB response is moving too slow, not getting the results that it needs, although the disease is preventable, curable. The world has not mobilized in the same way as it mobilized for COVID, for example, this year. And the presidents of the countries have come together to make ambitious commitments. One of them is actually around childhood TB, about the need to improve and reduce the number of children who are affected by TB, to improve access to affordable quality medicines that are easy for children to take, and to remove the barriers in accessing the diagnostics and making it visible. So where we are at, actually this year, the communities report, the communities of civil society organizations came together and made a shadow report to the UNHLM or UN high-level meeting on TB to see if we are managing to get to that progress. And in fact, for children, there is progress, but not as fast as we would like it to be, and not as at the level that we want it to be. And a few areas that where progress is needed is improving access to childhood formulation for medicines. And the fact that too many children still, have to take, affected by TB, have to take adult formulation of crushed medicines, when in fact there are child-friendly formulations in the world. So the other area that I think is very important for today's meeting is that COVID has shown us that a respiratory disease is just this, a respiratory disease. If it's treated, it's a past you, and everyone moves on. Unfortunately for TB, it's not only a respiratory disease. It comes with a lot of shame related to it. There's a lot of stigma related to TB, and we need to change that. And actually, seeing you going through COVID and understanding it's only a disease that is respiratory and it's everyone can get affected. This is the same approach we need to take for TB. TB is just a respiratory disease that can be treated, can be prevented, and if we all provide support and don't think about it as a disease that has some connotation, negative connotation, we can fight it, we can improve everyone's health, and we can make children as our partners in this fight and in ending TB. And remember, you are the generation that are going to see ending TB in 2030, 2035 or earlier. So together we can. Thank you.
Thank you, Mrs. Stela. İlk sözü elmi tədqiqat ağciyər xəstəlikləri